If you are over 60, your kidneys may be sending warning signs right now, even if you feel fine. Kidney problems often develop quietly, without pain, and many seniors do not realize anything is wrong until serious damage has already happened. Small changes in your body can be easy to ignore, but they may be early signals that your kidneys are under stress. Today, I will explain 5 kidney warning signs that people over 60 should never ignore, and why paying attention early can make a real difference for your health. As we get older, many changes happen inside our bodies, and the kidneys are no exception. After the age of 60, kidney function naturally begins to slow down. This does not mean something is wrong right away, but it does mean the kidneys become more sensitive to damage. The kidneys play a vital role in keeping the body healthy. They filter waste from the blood, remove excess fluid, balance minerals, and help control blood pressure. When the kidneys are not working well, these important processes can slowly break down. One of the biggest problems is that kidney disease often develops without clear warning signs. Many seniors feel fine and continue their daily routines while kidney function quietly declines in the background. There is usually no sharp pain or sudden illness in the early stages. Because of this, many people over 60 assume that tiredness, mild swelling, or changes in urination are simply part of aging. These symptoms may seem small or harmless, so they are often ignored for months or even years. Unfortunately, by the time kidney problems become obvious, significant damage may have already occurred. This is why early awareness is so important. Recognizing warning signs early gives you a chance to protect your kidneys before serious complications develop. In the next part of this video, I will explain why kidney damage happens silently and why paying attention to small changes in your body can make a big difference, especially after the age of 60. One of the most dangerous things about kidney disease is how quietly it develops. Unlike many other health problems, kidney damage usually does not cause pain in the early stages. This is why so many people over 60 are unaware that their kidneys are slowly weakening. The kidneys work silently every day. Their main job is to filter waste, toxins, and extra fluid from the blood. They also help balance important minerals and support healthy blood pressure. When the kidneys begin to lose function, these changes happen gradually, not suddenly. At first, the body tries to adapt. Other systems work harder to compensate for the kidneys, so symptoms remain mild or easy to overlook. You may feel slightly more tired than usual or notice small changes in your body that do not seem serious. Because there is no sharp pain or strong discomfort, many seniors assume nothing is wrong. They continue their normal routines, unaware that damage is slowly progressing. This is why kidney disease is often called a silent condition. Another reason kidney problems go unnoticed is that early symptoms often look like common signs of aging. Feeling low on energy, having mild swelling, or waking up at night to urinate can all seem normal after the age of 60. As a result, these warning signs are often ignored. Over time, as kidney function continues to decline, waste products begin to build up in the blood. Excess fluid may no longer be removed properly. This puts extra stress on the heart, blood vessels, and other organs. By the time clear symptoms appear, such as severe swelling, extreme fatigue, or major changes in urination, kidney damage may already be advanced. At this stage, treatment options become more limited. This is why early awareness is so important. Paying attention to small changes in your body gives you a chance to act before serious damage occurs. Early detection can help slow the progression of kidney disease and protect your overall health. In the next part of this video, we will begin discussing the first kidney warning sign. These are signs many people over 60 experience, but often overlook. Recognizing them early can make a real difference in protecting your kidneys. The first kidney warning sign people over 60 should never ignore is swelling in the feet, ankles, or lower legs. This symptom often appears slowly and may seem harmless at first, which is why so many seniors overlook it. Healthy kidneys remove excess fluid and sodium from the body. When kidney function begins to decline, this extra fluid can start to build up instead of being properly eliminated. Gravity causes the fluid to settle in the lowest parts of the body, especially the feet and ankles. You may notice that your shoes feel tighter than usual, or that your socks leave deep marks on your skin by the end of the day. Some people see puffiness around the ankles or swelling that makes the skin feel stretched or shiny. These changes are not always painful, which makes them easy to ignore. Many seniors assume this swelling is caused by standing too long, walking less, or poor circulation. While these factors can play a role, swelling that appears regularly or worsens over time should not be dismissed. Persistent swelling may be an early sign that your kidneys are struggling to manage fluid balance. Pay attention to when the swelling occurs. Kidney-related swelling often becomes worse in the evening and improves slightly overnight when you lie down. It may affect both feet and ankles at the same time, rather than just one side. This pattern is an important clue. Another warning sign is swelling that does not fully go away after rest or elevation. If you raise your legs and the swelling remains, this could indicate ongoing fluid retention. In some cases, swelling may also appear in the hands or around the eyes, especially in the morning. Fluid buildup caused by weak kidney function puts extra strain on the heart and blood vessels. Over time, this can increase the risk of high blood pressure, heart problems, and further kidney damage. This is why swelling should never be ignored, even if it seems mild. If swelling is accompanied by fatigue, shortness of breath, or changes in urination, the warning becomes even more serious. These combined symptoms may indicate that kidney function is declining and needs medical attention. It is important to understand that swelling is not a normal part of aging when it happens frequently or worsens over time. Aging alone does not cause the body to retain excess fluid in this way. When swelling becomes persistent, it is your body's way of signaling that something is not working properly. If you notice ongoing swelling in your feet or ankles, especially after the age of 60, it is important to discuss this with a healthcare professional. Simple tests can help determine whether your kidneys are involved and whether early action is needed. In the next part of this video, we will discuss the second kidney warning sign, which involves changes in urination. This is another sign many people over 60 experience but often fail to take seriously. The second kidney warning sign people over 60 should never ignore is noticeable changes in urination. This is one of the most common signs of kidney trouble, yet it is also one of the most overlooked. As we age, it is normal for some bathroom habits to change slightly. However, sudden or ongoing changes in how often you urinate, how much urine you produce, or what your urine looks like can signal that your kidneys are under stress. One common change is urinating more frequently, especially at night. Waking up once may be normal, but waking up 2, 3, or even 4 times every night can be a warning sign. When the kidneys are not working properly, they may struggle to concentrate urine, leading to increased nighttime urination. Another important sign to watch for is foamy or bubbly urine. While occasional bubbles can be harmless, persistent foam may indicate excess protein leaking into the urine. This is often an early sign of kidney damage and should not be ignored. Changes in urine color can also provide important clues. Very dark urine may suggest dehydration or poor filtration, while unusually pale or clear urine may indicate that the kidneys are not balancing fluids correctly. Urine that appears cloudy or has an unusual odor can also signal problems. Some people notice a weaker urine stream or difficulty starting urination. Others feel like the bladder is never completely empty. On the opposite end, some seniors produce very little urine despite drinking enough fluids. Both situations can indicate kidney-related issues. Blood in the urine, even in very small amounts, is another serious warning sign. It may appear pink, red, or brown. This should never be considered normal and always requires medical evaluation. Many people dismiss these changes as normal aging or blame them on the prostate, medications, or minor infections. While these factors can play a role, kidney problems are often part of the picture, especially after the age of 60. Ignoring changes in urination allows kidney damage to progress quietly. Over time, waste products can build up in the blood, increasing strain on the heart and other organs. Early attention can help prevent serious complications. If you notice ongoing changes in urination, especially when combined with swelling, fatigue, or weakness, it is important to speak with a healthcare professional. Simple urine and blood tests can provide valuable information about kidney health. In the next part of this video, we will discuss the third kidney warning sign. This sign is more subtle but extremely common in people over 60 and often mistaken for normal aging. The third kidney warning sign many people over 60 overlook is persistent fatigue and weakness. Feeling tired from time to time is normal, but ongoing exhaustion that does not improve with rest may be a sign that your kidneys are not working properly. Healthy kidneys help remove waste products from the blood. When kidney function declines, these waste substances can begin to build up in the body. As a result, you may feel constantly drained, sluggish, or mentally foggy, even after a full night's sleep. Another important role of the kidneys is helping the body produce a hormone called erythropoietin. This hormone signals the body to make red blood cells, which carry oxygen throughout the body. When the kidneys are damaged, red blood cell production can drop, leading to anemia. Anemia reduces the amount of oxygen reaching your muscles and brain. This can cause weakness, shortness of breath during simple activities, dizziness, and difficulty concentrating. Many seniors assume these symptoms are just part of getting older, but they may actually be signs of declining kidney function. You may notice that tasks you once handled easily now feel exhausting. Walking short distances, doing household chores, or even standing for long periods may leave you unusually tired. Some people also experience headaches or feel lightheaded when standing up. Fatigue related to kidney problems often develops slowly. Because it worsens over time, many people adjust their routines without realizing something is wrong. They may rest more, move less, and gradually accept lower energy levels as normal. However, persistent fatigue is not a normal part of healthy aging. When tiredness interferes with daily life or continues for weeks without a clear reason, it should be taken seriously. This is especially true if fatigue appears alongside other warning signs, such as swelling or changes in urination. Weak kidneys also affect the balance of electrolytes in the body, such as sodium and potassium. When these levels are disrupted, muscle weakness, cramps, and irregular heart rhythms may occur. These symptoms further contribute to feelings of exhaustion and discomfort. Ignoring chronic fatigue can allow kidney disease to progress unnoticed. Over time, declining kidney function increases the risk of heart disease, infections, and other serious complications. If you or someone you care for feels unusually tired most days, especially after the age of 60, it is important to discuss this with a healthcare professional. Blood tests can help identify anemia or waste buildup related to kidney health. In the next part of this video, we will discuss the fourth kidney warning sign. This sign often affects appetite and digestion and is frequently mistaken for a stomach issue rather than a kidney problem. The fourth kidney warning sign people over 60 should never ignore is loss of appetite, nausea, or digestive discomfort. These symptoms are often mistaken for stomach problems or normal changes related to aging, but they can be closely linked to declining kidney function. When the kidneys are healthy, they remove waste and toxins from the blood. As kidney function weakens, these waste products begin to accumulate. This buildup can affect the digestive system and alter how food tastes and feels in the body. Many seniors notice a reduced desire to eat. Foods they once enjoyed may suddenly taste unpleasant or leave a metallic or bitter taste in the mouth. Some people feel full very quickly, even after eating small portions. Others experience ongoing nausea, especially in the morning. In more advanced cases, vomiting may occur without a clear stomach-related cause. This can lead to unintentional weight loss and poor nutrition over time. Because these symptoms develop gradually, they are often overlooked or blamed on stress, medications, or digestive issues. Another common complaint is a constant feeling of discomfort in the stomach area. This may include bloating, indigestion, or a general sense of unease after meals. These symptoms can come and go, making them easy to dismiss. Kidney-related digestive problems often appear alongside fatigue and weakness. When the body is overloaded with waste, energy levels drop and the digestive system becomes less efficient. This combination can significantly affect overall quality of life. Poor appetite and nausea also increase the risk of dehydration and electrolyte imbalance. When food and fluid intake decreases, the kidneys are placed under even more stress. This can create a cycle where kidney function continues to decline. Many people over 60 accept these changes as a normal part of aging. However, persistent appetite loss or nausea is not a normal sign of healthy aging. These symptoms deserve attention, especially when they last for weeks or worsen over time. If you notice ongoing digestive discomfort, changes in taste, or unexplained weight loss, it is important to consider kidney health as a possible cause. Simple blood and urine tests can help identify whether waste buildup is affecting your body. Addressing kidney-related digestive symptoms early can help prevent more serious complications. Early treatment may improve appetite, restore energy levels, and slow the progression of kidney disease. In the next part of this video, we will discuss the fifth kidney warning sign. This final sign often affects the skin and muscles and is frequently ignored until kidney damage becomes more advanced. The fifth kidney warning sign people over 60 should never ignore is persistent itching, dry skin, and frequent muscle cramps. These symptoms may seem unrelated to kidney health, but they often appear when kidney function has been declining for some time. Healthy kidneys help maintain the proper balance of minerals in the body, including calcium, phosphorus, and potassium. When the kidneys are not working well, these minerals can become imbalanced. This imbalance can affect the skin, nerves, and muscles. Many seniors experience ongoing itching that does not improve with moisturizers or changes in soap. The skin may feel unusually dry, tight, or irritated, even when there is no visible rash. This itching is often caused by a buildup of waste products in the blood, which irritate nerve endings in the skin. Unlike common dry skin, kidney-related itching can be widespread and persistent. It may affect the arms, legs, back, or entire body. Scratching may bring temporary relief, but often makes the irritation worse over time. Muscle cramps are another important warning sign. These cramps often occur in the legs, especially at night, and can be sudden and painful. Electrolyte imbalances caused by weak kidney function interfere with normal muscle contraction and relaxation. Some people also experience muscle twitching or a feeling of restlessness in the legs. These symptoms can disrupt sleep and contribute to fatigue, creating additional strain on the body. Many people blame itching and cramps on dehydration, aging, or lack of physical activity. While these factors can contribute, persistent symptoms should not be ignored, especially after the age of 60. As kidney disease progresses, waste buildup and mineral imbalance can worsen. This increases discomfort and raises the risk of more serious complications, including nerve damage and heart rhythm problems. If you notice ongoing itching, dry skin, or frequent muscle cramps that do not improve with simple measures, it is important to consider kidney health as a possible cause. These symptoms often appear alongside fatigue, appetite changes, or abnormal urination. Early evaluation can help identify mineral imbalances or waste buildup before kidney damage becomes severe. Addressing these issues early may relieve symptoms and help protect kidney function. In the next part of this video, we will discuss who is at the highest risk for kidney disease. Understanding your risk factors can help you take action before serious problems develop. Certain people over the age of 60 are at a much higher risk of developing kidney disease, even if they feel relatively healthy. Understanding these risk factors can help you recognize whether you should pay closer attention to kidney warning signs. The biggest risk factor is age itself. As we get older, kidney function naturally declines. This makes the kidneys more vulnerable to damage from illness, medications, and lifestyle factors. After the age of 60, even small stresses on the kidneys can have a greater impact. High blood pressure is another major risk factor. Over time, elevated blood pressure damages the tiny blood vessels inside the kidneys. This reduces their ability to filter waste effectively. Many people live with high blood pressure for years without symptoms, allowing kidney damage to progress silently. Diabetes is also one of the leading causes of kidney disease. High blood sugar levels damage the kidney's filtering system. Even well-managed diabetes can still affect kidney health over time, especially in older adults. Long-term use of certain medications increases risk as well. Pain relievers, anti-inflammatory drugs, and some prescription medications can strain the kidneys when used frequently or for many years. This risk is higher in seniors, whose kidneys are already more sensitive. Heart disease, obesity, and a family history of kidney problems also raise the risk. Smoking and dehydration further increase strain on the kidneys. If you recognize yourself in one or more of these risk groups, regular kidney checkups become especially important. Simple blood and urine tests can help detect early changes before serious damage occurs. In the next part of this video, we will discuss when it is important to see a doctor and what warning signs should never be ignored. Knowing when to see a doctor can make a critical difference in protecting your kidney health, especially after the age of 60. Many people wait too long because symptoms feel mild or seem manageable. Unfortunately, kidney disease often worsens quietly during this delay. You should consider seeing a healthcare professional if any kidney warning signs persist for more than a few weeks. Ongoing swelling in the feet or ankles, repeated changes in urination, constant fatigue, appetite loss, or unexplained itching should never be ignored. It is especially important to seek medical advice if several symptoms appear together. For example, fatigue combined with swelling or changes in urine may signal that kidney function is declining. These patterns are often more meaningful than a single symptom alone. Blood in the urine, even in very small amounts, always requires medical attention. Severe swelling, shortness of breath, or sudden changes in urine output are also signs that should be evaluated promptly. If you have diabetes, high blood pressure, or heart disease, regular kidney checkups are essential, even if you feel well. Routine blood and urine tests can detect early kidney damage before symptoms become severe. Many seniors worry about what tests may involve. In most cases, kidney evaluation is simple and non-invasive. Blood tests measure waste levels, while urine tests check for protein or blood. These tests provide valuable information and can guide early treatment. Early medical attention does not always mean serious treatment. In many cases, small changes in medication, diet, hydration, or blood pressure control can slow or even stop the progression of kidney disease. Listening to your body and acting early gives you the best chance to protect your kidneys and maintain quality of life. Ignoring warning signs only increases the risk of complications. In the final part of this video, we will review the key points and discuss how staying informed can help you take better care of your kidneys as you age. As we reach the end of this video, it is important to remember one key message. Kidney problems do not usually appear suddenly. They develop slowly, quietly, and often without pain, especially in people over the age of 60. Small changes in your body can be early warning signs. Swelling in the feet, changes in urination, ongoing fatigue, loss of appetite, itching, or muscle cramps should never be ignored. These signals are your body's way of asking for attention. The good news is that early awareness can make a real difference. When kidney problems are identified early, simple steps can help protect kidney function and slow further damage. Paying attention now may help you avoid serious complications later. If you recognize any of these signs in yourself or someone you care about, consider speaking with a healthcare professional. A simple checkup can provide clarity and peace of mind. If you found this information helpful, consider subscribing to the channel for more trusted health guidance. Taking care of your kidneys is an important part of staying healthy and independent as you age. Thank you for watching, and take good care of your health.